everybody. This is Daniel Vucic. She works for SiREN, and Daniel's joined us today to give us a bit of a bite on what SiREN does, and also a little bit about himself. So, Dan, can I just get you to introduce yourself, but also can I ask you to give us a bit of a background on what brought you into the world of sexual health?
Yeah, absolutely. So hi everyone, and I also pay my respects to elders past and present, and acknowledge that I'm on Wajak Noongar Budja. So yeah, I guess I started life originally as a lawyer, and was really passionate about working with Indigenous people. During uni, I worked for Indigenous Land Council up with the Yamachi region, and then after uni, I worked in the Supreme Court and went on sort of criminal law circuits up to the Kimberley. And yeah, I just kind of remember feeling that the law was kind of mostly trying to sort of fix problems after they'd happened, whereas I kind of felt like I wanted to do something sort of more proactive that tried to sort of improve people's lives from the outset. And so I went over to the UK and decided to retrain. And so I did a master's in development studies and focused on the way in which Aboriginal health policies are made. I then did my PhD over there in public health and kind of focused on Indigenous tobacco control interventions. And after coming back to Australia, I kind of really, knew that I wanted to work in the Aboriginal health space. And so eventually a job came up.
Oh no. Dan, we've lost you for a second.
This happens with Dan.
Does it?
Yes.
We lose him. Oh,
Sorry
there he
about
is.
that. There we
He
go.
does come back.
So yeah, eventually a job came up working in WA Health in their Aboriginal portfolio in the sexual health team. And yeah, I just, fell in love with it while I was there, kind of led to development of a bunch of resources that people might know, like the Yarning Quiet Ways book and the Let's Yarn website and the Healthy Conversations DVD and a few of the Aboriginal campaigns. And yeah, I guess from there I went and worked at Aqua and sat next to Veronica, and originally coordinated the Young Deadly Free program in Warburton and Carnarvon and Geraldton, and then set up the Young Leaders program, which is still running today and has a sexual health focus and is really kind of growing in leaps and bounds. And it's been really delightful to kind of see that happen. Yeah, and my time at Aqua was, genuinely a career highlight, and yeah, I look back on it really fondly. But yeah, all the travel that I was doing wasn't particularly conducive to kind of family life, and so since 2019, I've been working at Curtin Uni, and have stayed in sexual health, and I'm working on a range of sexual health projects with people from migrant communities, but also with Aboriginal populations. And I still sit on the WA Health Ethics Committee as well. And so, although I kind of stumbled into sexual health by accident, I really can't think of a sector that I'd rather be in. I think that the work is really interesting. It's, really important work. It goes to, people's human rights and their understandings of self and the way in which they express themselves. But, it's also really challenging because there is so much stigma and taboo, and that makes it sort of a really interesting space to work in. And I think that the sector, is really fun and filled with lots of really fun people, and we have lots of laughs, even though the work that we're doing is really serious. And so I like the fact that it's a sector that doesn't take itself too seriously. And yeah, I'm still here and still intend to be here for a long while.
Oh, Yeah, that's great. And I'm glad that you mentioned the Young Leaders Program, because I don't know whether a lot of people knew that you actually, worked here. Yeah, I can see Stephen sort of going, yeah. So actually, Daniel started off the Young Leaders Program here at Aqua, and both Katiska and Rachel, who work in that program here, which is funded by a Sexual Health Bloodborne Virus Program, they're both actually delivering that program in Mullawa, which is just near Geraldton. So, so they're out there at a school delivering the Young Leaders Program to some young Aboriginal Torres Strait Islander kids there. So it is alive and well, and yeah. So Dan, a lot of your hard work is still paying off today. So that's really great. So with SiREN, I mean, I know that there's nobody online at the moment, but obviously, we're going to record it and make it available for people. So we just wanted to really know about, the role of SiREN and how did the need for this service come about?
Yeah, sure. I've got some slides that I can share as well that might be useful for people. So I'll just try and bring those up. There we go. Are the slides showing there?
Yep.
Great. Yeah. So, yeah, just in terms of what SiREN is, so we're the WA Sexual Health and Bloodborne Virus Applied Research and Evaluation Network. And I guess the concept of SiREN really emerged from a recognition that although there were lots of kind of research bodies working in the sexual health space over east, the Kirby Institute, University of New South Wales, La Trobe, Western Australia, as a result of its geography and its demography and its population, really had specific sexual health and bloodborne virus needs, which required kind of more localized research and evaluation approaches. And so we were established back in 2010, funded by WA Sexual Health and Bloodborne Virus Program. And we work in partnership with researchers and service providers and policymakers to make sure that we were able to kind of develop the evidence base around what works in sexual health and what the emerging kind of priorities are. So our work kind of has these three aims. And so the first is that kind of workforce capacity building stuff. So trying to strengthen the research and evaluation skills of the sexual health and bloodborne virus sector in WA to, support best practice. The second aspect of what we do is really about sort of creating networks. So creating sort of opportunities to build the evidence base and ensure that sort of research findings that come out of Curtin University and other places are really translated into policy and practice. And so we don't just want sexual health research to be sitting on shelves gathering dust. We actually want it to make a difference to people's lives. And so what we try to do is sort of promote the real life implications of those research to the sector where that information is needed. And then third, we try to establish partnerships between WA and the national research centres and peak bodies, just to sort of make sure that we're raising the profile of sexual health and bloodborne virus concerns affecting Western Australian. So there's kind of an advocacy role there as well. V, do you want me to go on to sort of some of the specific stuff that SiREN does as well?
Yeah, because I was, I would love that, because when you go to the website, like, it's a fantastic opportunity for people to navigate and actually see what's available. I'd love you to talk about the toolkit. I don't know, because I have actually used that myself and found that really, really helpful, particularly around making sure that you're actually doing a bit of homework before you decide that you want to delve into something. And I think that the toolkit really outlines that really well. So it gives you almost like a tick box to think, have I done that? Have I done that? Have I made sure that I have consulted properly and that sort of thing? And I I still use that today, because I think that sometimes you can almost get a little bit too comfortable in your space, and it might not always be suitable in some areas. So you've got to sort of keep bringing yourself back to make sure that you've actually gone about things properly, particularly when we're working with Aboriginal Torres Strait Islander community. Yeah, so I really love the toolkit.
Great. No, that's really good to hear. So, yeah, I mean, what we kind of believe is that sort of research just shouldn't be kind of in the hands of people who are professional researchers. We think kind of everyone in the sector, has the capacity to sort of, generate knowledge that's going to be useful for sort of the broader sector. And so our role is kind of helping people to realize that, and also, helping to step them through the process as to how to sort of do research so that they can feel confident, because often people just think research is just something that experts do, whereas we all have the capacity, and it's really useful for what we do on an everyday basis. And so I guess the thinking behind the toolkits, and I can sort of talk a bit more about those later, but that particular toolkit that you're talking about is really intended to be like a step-by-step guide for people who might be new to health promotion, but also people who might have been working on it for a while, who just want to kind of brush up on their skills and just also check that they haven't forgotten steps along the way. And so, it provides a really good introduction as to, what are the principles of health promotion, how do we sort of change the way in which people behave and think about health, and then really encourages us to kind of engage with those theories to help us design programs that are informed by kind of the theory and the evidence and the literature that's there. And then kind of steps you through, well, what next? You've kind of got this idea as to sort of what this program is going to look like, and you have a really good sense that, it's probably going to work. But what do you need to do to get it from an idea into practice? And so it kind of steps you through, as you say, all the things that you need to go through, how to conduct a needs assessment, how to do consultation, how to think about how you're going to evaluate that program to actually demonstrate to your funders that it is something that's really valuable and that should be scaled up in the future. So encourage people to have a look at that, definitely.
It's also, I think it also acknowledges that a lot of people are actually already doing it, are actually already delivering some type of program, education, whether it be one-on-one or community, and they don't actually realise that they're actually doing it. And perhaps, for reporting purposes, it actually also acknowledges that you could be reporting on things that you don't realise that you're already doing. And so I find that that's really helpful in acknowledging the work that you're already doing.
Absolutely. And as
Um,
kind of Peter, sort of who sits on the WA Health Ethics Committee and joins us here, sort of knows as well, like we really sort of, value the idea of kind of co-design and sort of participation from the sector in research that's happening, because it makes sure that sort of any knowledge that's being collected is kind of relevant to the communities. It actually benefits the communities, that it reflects their needs and their priorities. And so, anything that we can do to try to build the capacity of the community to actually undertake its own research, that's exactly what SiREN's there for.
And the evaluation side of it as well. People get very nervous about evaluation and think it's really hard. And unfortunately, we are funded on providing evidence that something we do is actually maybe making a difference. And that difference only needs to be very small, and that difference doesn't always have to be in numbers. It could be just some feedback that you're getting from people. So trying to capture that information is so important, and I think SiREN assist with that. How can you capture that evaluation feedback from what you're doing, and and that's really important as well.
Yeah, absolutely. So we were up in Broome last week, running some training for as part of the Kimberley Sexual Health Forum there. And the theme of that training workshop was kind of practical evaluation techniques for busy health workers. And it's just a recognition that, actually we think of evaluation as this big scary thing that can only be done by kind of academics, but actually, it's something that we all need to do, because as you mentioned, we have sort of reporting obligations to our funders, but sort of B, there's also an ethical component there to kind of make sure that, the things that we're doing are actually benefiting the communities that we're serving, that they're using the scarce resources that we have available to, have the biggest impact, and also just to make sure that things that we're doing aren't having any sort of unintended harmful consequences on the community, because, that can happen. And so, evaluation really is important. And sort of the point of the training that I delivered was to try to sort of make the point that it doesn't have to be complicated. So actually any data you collect is better than collecting nothing. And so rather than sort of telling people to kind of aim for perfection and, randomized controlled trial type stuff, to actually recognize that, often the communities that we're working with have, they might have low levels of literacy or competing health priorities, which means that, it's often really difficult to sort of ask people to complete a survey, or, you're running an education session in the community and you can barely cover the content that you want to cover, let alone sort of factor in some evaluation component. And so really it's about saying, how do we make it easy? What are some sort of strategies that we can use to kind of make it quick but still get information that we need? So I'm happy to sort of share those slides as well, Veronica, which might be sort of useful for people as well.
Yep. Okay. All right. Well, maybe at this point I will get you to perhaps share a couple of those. You mean like share them now, or?
Yeah. So I've got the slides from the evaluation workshop that I can share after the fact, but I've also got some things that just talk through the other sort of services that SiREN can offer, which might be useful for people.
Yeah, no, that'd be great, because there are so many things. It's not, I mean, even if you want to go to a conference and you've got to present, SiREN can help you out there. If you need to write an abstract, just that whole word abstract nearly gives me chest pain. Well, it used to, but I actually can write an abstract okay now, and it's because SiREN have helped me, and I've had a go, and I've had a couple of goes, and I actually don't get as bad a chest pain as I used to. So it's not too hard. So for anybody out there who's, perhaps feels that they could present at a conference, if you need a hand with an abstract, SiREN are fantastic, and if you can't get them, I'll help.
Absolutely.
Sounds like that's good qualitative data, Daniel, that you should be putting into
that's evaluation data.
Yeah.
Glad this is recorded, Veronica. Excellent. I'll just show you my next slide. So just in terms of the other stuff that SiREN does, so every month we send out an e-newsletter. So if you just go to the bottom there, you'll see our email address. Just email us to join the mailing list, but it just sort of tries to collate everything that you might need to know about the sector. So any recent research that's come out, any major policy announcements, changes in clinical protocols, upcoming training opportunities, all of that stuff is in our e-news. So keep an eye out for that and join the mailing list if you haven't already. The other thing is every quarter we publish these online evidence updates, which, just kind of recognize that, everyone wants to sort of be sort of evidence-based and evidence-informed, and to sort of make sure that they're, keeping up with what the literature is saying. But it's really hard to do when you're really busy, and often you don't have access to the articles because they're, behind paywall or whatever. And so we try to sort of provide these easy to digest summaries of all the sexual health and bloodborne virus research that comes out that might be useful to you, to help you sort of design and deliver effective programs. And so there's a link to that on our website. So check that out. And then every couple of years, who are these handsome people? We host a sector symposium where we bring together academics and service providers and policymakers, to share our knowledge about what works and why, and to sort of help each other sort of identify what the emerging priorities are in the sector. And so our next one will be next year, so keep an eye out for that. And the Department of Health is really great in offering bursaries to help people in the regions to attend that. So yes, definitely join our mailing list so that you can know when that's happening, and you too can have as much fun as Veronica and Raglan and Katiska are having in that photo. And then every single day we also post social media content on our Twitter account. And that just kind of keeps you updated with what's going on in the sector. If we hear about, a webinar or a training opportunity that might be useful to you, we'll put that up there so that and we're also happy to kind of use our social media to kind of promote things that you're doing as well and want to reach a sort of broader audience with. So, feel free to get in touch if you have content that you want us to share. And then these are the toolkits that Veronica mentioned. So the idea is they're intended to provide really, helpful how-to guides to walk you through how to do things. We've talked about the program planning one. There's also one about ethics approval and how to navigate that process. And, there's also one about how to develop culturally appropriate HIV sort of resources. So, encourage you to use those whenever you need them. And then we've also started developing these online short courses, and we kind of recognize that, the sector's really busy and you don't have time to, go off for 2 days and to do, a face-to-face training course. And so we've got these courses that can be completed at your own pace. You can do, 10 minutes a day, whatever works for you. They're entirely online, but they're designed by the people that deliver our health promotion degree here at Curtin, and so they're a really high quality. And we currently have 4 modules, and one of them is about evaluation, and so that's something else that you can check out if you like. We also deliver training. So I mentioned the training that we did in Broome. We've also done training about how to communicate your project results. So, how to present your findings at conferences, that kind of stuff. So if you join our mailing list, you'll find out about those also. And we also get contracted by organisations to undertake independent evaluation and research. So currently, Aqua and SWAMS have approached us to help them evaluate their new syphilis campaign. So we've worked with them on sort of designing an evaluation strategy and have been collecting the data and doing pre and post surveys, and also looking at clinic data and some interviews in order to give them a better sense as to what worked really well and what could be improved and how. We also have done the evaluation for the Young Deadly Free project at a national level. And we're also involved in this really cool kind of clinical trial at the moment called the SKIP trial. So basically it's run by TKI and UWA. It's looking at a new treatment protocol for syphilis. So instead of giving 2.4 sort of million units of benzathine penicillin G sort of once a week for 3 weeks, we know that sort of people tend to sort of drop out and not receive all 3 doses. And so they're doing a trial as to whether they can administer a larger dose in one sitting over a longer period of time, to try to sort of make sure that everyone can complete their treatment. And we're doing the sort of consumer acceptability side of things, and actually working with communities and patients to work out whether the new treatment kind of meets their needs and expectations. And then, we've also got other projects like Healthy Blood, Healthy Body, which is about increasing access to needle and syringe programs. And, whenever, as Veronica says, you have a question about, how do I do a conference abstract? How do I design a survey? I want to interview people, but, I don't feel confident doing it. Can you give us some tips? Just email us, and that's exactly what we're there to do. So, feel free to reach out. We're a friendly mob, as you can see from that picture.
Yeah, definitely a very friendly mob. That was great, Dan. Can I ask you something about the health promotion short course?
Yeah, absolutely.
So now it's online and also available face to face as well. If you so because I did it a long time ago. Have you done it yet?
I'm signed up to it, but I haven't finished it.
You haven't finished it, so you're signed up to the online.
Yeah.
Are you? Okay. So when I did it, we were actually able to think up something that we would like to do, like whether you're, so for example, I think I wanted to increase STI testing amongst young women aged between in a remote community. So, and then we put together all these ideas. I actually worked with another girl who happened to be Sunny, who I still work with today. And then we were doing the health promotion short course. At the time, we were putting together all these ideas. So we literally developed this little program whilst doing the health promotion course with the support of SiREN. So is that still the case? Like, is that
So
an example of what maybe you'd like to do?
Yep. So throughout the online course, there's kind of opportunities to kind of apply it to your practice, and also there's kind of opportunities to get one-on-one feedback from sort of the course coordinators to help you develop that sort of stuff. There's also going to be an opportunity, as you say, to do face-to-face, and in the face-to-face version, there really will be sort of that emphasis on, you know, how can we support you to sort of build something that is going to be actually useful to you and your job. So not just kind of abstract skills, like, you know, how do we give you something that you can take away and then work on.
Yeah, that's really good. That's what I loved about it. I not only, you know, got all the benefits of actually doing a health promotion course, but I actually got to support a delivery of a program that, so that was great. I love that. Was there any other questions? I guess my final question, it would be, so, you know, somebody out there who might be listening to this recording, they wanted to get in contact with you. They would just go through the website, Dan, or would be the best way?
Yeah. So just you can email SiREN, SIREN at curtin.edu.au, and we'll be able to respond very, very quickly. You know, we really kind of live to actually help people in a practical way, and so you know, often we'll get emails from people saying, you know, we're working on this business case on this area, and you know, want to find relevant literature, and you know, we will send that to them. We're just, you know, we're very keen to help you in a practical way, so you should definitely not hesitate to email us.
There's Roberta. We're just about to finish up, Roberta, but I've recorded it so you can actually watch it.
Okay, no worries. Thanks for that, Veronica. For some reason, I thought it was 12:30, but I will definitely catch the next one.
Yeah, that's okay. It's great to see you. Really good. Stay online because I want to have a yarn with you.
Yep, no worries.
All right. Daniel, thank you so much.
Thank you.
I don't know whether Stephen or Peter had any questions for you. No, all good. That was really great. And I hope that anybody out there that actually listens to this recording, if you just go to the SiREN website, it is so easy to navigate and you will actually find everything that you need on there. But as Daniel said, just email SiREN and someone will respond to you straight away. But a really wonderful resource, and we're so grateful that we've got you guys. So thanks very much for coming along to our bite today.
My great pleasure. Thank you for having me.
Thanks,
See you
guys.
later.
See ya.